for Social Responsibility, and this is the fourth in our series of monthly webinars for our climate health action teams. I'd like to begin tonight by announcing a change in personnel. We have a new climate organizer. Her name is Tassa Regan. I think many of you on the phone might have either spoke to her on the phone or maybe received an email from her. In any case, she's managing our climate health action teams, and she will be our MC tonight. So, Paz, take it away.
Thank you, Barb. Good evening, everyone, and also want to extend my welcome to all of you. Today's webinar will focus on why natural gas is not an alternative to coal. Our speaker will be Dr. Catherine Thomasson, PSR's Executive Director. Also on the call is Julia Morgan, PSR's Webmaster, who will be our webinar technician. Before we get started, I want to do some housekeeping. The webinar is scheduled to last 1 hour. It will be recorded so you can re-watch it or share with friends. It will be available on our website, and I will also send you the link once it is posted. Tonight's agenda will include a brief introduction on the Climate Health Action Teams, a short report back of last month's action, and of course the highlight is Dr. Thomasson's presentation. We will be taking questions after Catherine Thomasson's presentation, and I invite you to submit written questions at any time in the box on the right hand of your screen where you see the word question. Just type there your question, and at the end of the presentation I will read the questions, and hopefully we'll be able to get through everyone's questions, comments. Finally, Barb Gottlieb will be presenting this month's action and walking us through how we can best move forward in our advocacy efforts on this issue. For those of you who are not aware what the Climate Health Action Teams are, they were created because PSR believes that the Clean Power Plan presents a historic opportunity to advocate for a truly health-protective energy system based on energy efficiency and sustainable energy such as wind and solar. And so to build support for those solutions, PSR is organizing Climate Health Action Teams chats at the state local level. The webinar is the main way of providing training and resources to these state advocates, where they will then get the information to then plan targeted actions in their state in support of the Clean Power Plan. At the moment, we have chat members in 49 states plus the District of Columbia. The chats that I'd like to give a shout out of very brief, the Harvard chat, which has had an incredible month of working on Harvard Heat Week, trying to convince the university to divest from fossil fuels. Also, models that are arising are like in Tampa and the San Francisco Bay Area, where team leaders are hard at work trying to find ways for the chat teams to meet face-to-face and to engage with each other. Last month's chat action focused on writing letters to governors and state air directors, urging them to make end-use energy efficiency their state's first option for reducing carbon dioxide emissions from power plants. So far, over 100 people have sent a letter to their governor and state air officials. We are only able to report back on those who used the Action Center or sent me an email reporting that they sent the letter. So I urge you to let me know of your actions after each webinar. I'm here to help resource you and assist you in any way I can. At this point, I'd like to introduce Catherine, our main speaker today. Catherine Thomasson is Executive Director of Physicians for Social Responsibility. She is an internal medicine physician working in both teaching roles and as a clinician for the last 30 years. She has taught climate change and public health at Portland State University and is an expert on issues ranging from nuclear weapons abolition, global warming mitigation and health, as well as nuclear power and nuclear waste. At this point, I invite Catherine to begin her presentation on why natural gas is not the safe, clean bridge fuel that so many tout as an alternative to coal.
Thank you so much, Paz. And I'm hoping that Julia will turn the screen over to me. There we go. Wonderful. All right. Well, it's a pleasure to have so many people on the call tonight. I think this issue is one of the most important issues, this topic of addressing why natural gas is just another dirty fossil fuel, especially in regards to how it can be used under the regulation for the Clean Power Plan, and why this material that I'm presenting tonight hopefully will convince you, as it's convinced me, that only energy efficiency and renewables are really the solution and not natural gas for implementing the Clean Power Plan. So this evening what I'm going to go through is how the use of natural gas for electricity raises actually more greenhouse gas than coal. I'll also review the threats to public health from hydraulic fracturing, and again, pointing the direction that we need to cover, which is energy efficiency and renewables as the best options, and the only options, really, for countering climate change through the Clean Power Plan. So, my next slide, I'm sure we'll click over in just a moment. Natural gas, as most of you know, is a fossil fuel that's formed when layers of berry plants and gases and animals are exposed to intense heat and pressure over thousands of years. It's found in pockets or it's intermixed with coal or petroleum products, which are formed in just the same way as natural gas. I'm having problems with my computer, guys, so if you could pull the slides up from your presentation, that would be helpful. I'm not sure why my slides are not advancing. Anyway, before these pockets of natural gas, when they're mined, can be used as a fuel, the material has to be processed to remove impurities, including water, to meet the specifications of a marketable natural gas. Julia, can you pull up the slides? Thanks. Yep, that's exactly the one I'm on. Terrific. So this graph shows where the United States gets its electricity by fuel source. And you can see in 2008 there was a dip that came with the recession, so electricity usage went down. And the ratios are listed for 2010. If you could advance the slide once, you can see that coal as a source of electricity has gone down by 6% in just 5 years, which is pretty remarkable. 3% of that, if you'll click again, was taken up by new renewables. Hydropower stayed about the same. And so renewables went up, primarily wind, by 3% in that 5-year time period. Again, a good achievement. And if you click again, obviously the remainder of that 6% drop in coal was made up by increases in natural gas burning. So the next slide. So this is not a trend that we should keep going. And the reason is because methane is the second largest greenhouse gas in the United States. As you can see from the pie chart on the right, natural gas and petroleum systems, along with natural gas released from coal mining, is 39% of the methane that's released in the United States. The second most important, which we should keep in mind for another talk, is animal husbandry. So cows, goats, sheep are releasing or belching a lot of methane, along with the management of manure from all of those animals. Methane is a volatile organic compound, and most of us on the call understand that volatile organic compounds, when they combine with nitrous oxides, actually create ground level ozone. So methane contributes to ground level ozone, which is the third largest greenhouse gas produced worldwide. And then lastly, we care about methane because it is such an intense greenhouse gas. The IPCC fifth report recalculated and calibrated that methane is 86 times more powerful than carbon dioxide over 20 years, and it breaks down in the atmosphere in about 14 years. So it's a very, very potent greenhouse gas. So go ahead and advance one. And so we care about that because it will bring us to a sooner tipping point, potentially. So if we go over 2 degrees centigrade with this high-intensity greenhouse gas emissions, we may have runaway, irreversible climate change. And we will have, go ahead and click again, all the health impacts of climate change that we are trying to avoid. Worsening droughts, increased ground level ozone, heat waves, extreme weather events that we know are already occurring and will only get worse. Next slide. So natural gas extraction has really changed in this country. Back in 2005, as you can see on the left, conventional gas extraction was kind of like sticking a straw in the earth to find pockets of natural gas that were brought up to the surface. In 2005, only 3% of natural gas produced in the United States was from hydraulic fracturing. But now, 35% is from unconventional mining. In addition, we still actually import 12.5% of traditionally mined gas from Canada. And currently, our laws relatively prohibit the export of natural gas, which has brought down the price of natural gas significantly. Next slide. So we have to ask ourselves, is natural gas a good bridge fuel for us to save time and get these renewables online, develop our infrastructure, or is it not? Well, the positive component of burning methane for electricity is that it only produces at the electrical power plant about 47 to 60% of the carbon emission than coal would do in producing the same amount of electricity. However, this savings of carbon emissions is countered by leakage of methane itself during the life cycle of mining it, producing it, transporting it, and then burning it. And as I've already stated, it's a stronger greenhouse gas. The picture here is methane that is bubbling up out of the ground in a well field that is on fire so that you can see it, because otherwise you wouldn't be able to, and it is also odorless. Go ahead and next slide. So where does all this methane leakage occur? Well, the original numbers up there are the EPA inventory about where this leakage comes from. So the original source, the drilling and hydraulic fracturing, occurs so that when the drilling occurs, it can hit pockets of gas on the way in, and it will vent these even before fracking occurs. Then there's backflow from the fracking fluid, and a lot of times the methane is just released rather than being captured. As you may recall from the slide that showed the hydraulic fracturing, there's supposed to be a cement casing that goes down the drill hole through the water table to prevent any gas that comes up, and as well as the fracking fluid, from escaping into the water table. And so there can be leaks or cracks in the cement casing that allows leakage to occur. That second component is during processing and production of the natural gas. A lot of times it is vented, so they actually release methane, or they use methane as a fuel on site to process it. but in so doing, release a lot of leakage. And then, of course, the methane, the natural gas, has to be transported through high-pressure pipelines, of which the majority are over 50 years old. Excuse me. Next slide. This table has three columns. The first is the percentage of leakage from a well, percentage of the amount of methane that's produced from the well that is actually leaked and is not captured. So there's the measurement of conventional well drilling and the loss upstream. The second column is the upstream leakage from hydraulic fracturing, and then the downstream, the pipeline and the leakage along those routes is the same whether the methane came from fracking or not. As you can see that there are two EPA segments here. The first one was from 1996, and these figures are not measurements at all. They were estimates. So it was estimated that only 1.1% of the methane that was captured was leaked. Hayhoe and his crew actually did measurements and found that in reality, 1.4% of methane was leaked upstream and about 2.5% downstream, for a total of 3.9%. Howarth and Ingraffia and the group at Cornell did an overview study looking at the numbers and came up with double the rate of leakage with hydraulic fractured wells at 3.3%. As a result of a variety of studies, the EPA has amended its estimates, as you can see, quite a bit. They really reflect Howarth and Hayhoe's work, although they still list 0.9% as the downstream or pipeline segment of leakage. And then there's a range of other studies that is listed there. Next slide. Oh, I'm sorry, my next slide I had left in there. Anyway, why these numbers matter, of course, is that methane, because it's a more powerful greenhouse gas, calculations have found that if it is greater than 2.8% leakage, that the impact on climate change is worse than coal. So in other words, taking the life cycle of coal and burning coal is going to release a certain amount of carbon dioxide, a greenhouse gas, whereas mining and processing and delivering the methane, if it's greater than 2.8% of the methane that is taken to the plant, it is worse in terms of greenhouse gases compared to coal. So there are a variety of studies now that are looking at actual measurements, taking airplanes over well fields and actually measuring how much methane is present at the well fields, and what they're finding is far higher levels than 2.8% in all of the studies, and there have been about 7 or 8 in the last 3 years, from 2012 to 2014. When they do on-the-ground studies, and there are a couple of studies that counter this and measure on the ground at the well field sites, primarily well fields that welcome that measurement, and they find the levels to be much lower. So what is probably missing in all of this is the amount of leakage that occurs over time from the wells that have been drilled. And as I mentioned, as you can see from this picture, the well has the dark lines around it near the top. That's the cement casing. It's estimated that hydraulically fractured wells have about a 6-fold increase amount of leakage around the well casing than standard or conventional wells. But even the standard or conventional wells, by industry standards, their estimation of leakage rate over time is anywhere from 2 to 60%. So a whole lot of leaking going on that is causing a lot of increase in greenhouse gas emission. Well, as many of you know, hydraulic fracturing in and of itself is a threat to public health. This picture obviously shows the trucking, over 200 tanker trucks per fracking at each well site. Has to bring the water in, has to take the wastewater out. So go ahead on to the next slide. Hydraulic fracturing uses a lot of chemicals to do a variety of things. The chemicals are used to keep the fluid flowing smoothly. They use sand to prop open the fractured fissures, as well as other organic compounds such as methanol. In Wyoming, which has some of the toughest state regulations that has fracking happening, requires some disclosures of the chemicals, but even there, not all, due to proprietary trade secrets. The fluid, of course, is then allowed to backflow, and it must be trucked away, though it's often left in standing pools, allowing some of these chemicals to evaporate, creating local air pollution. Next slide. The wells, of course, are drilled through the water table, and if the well casings hold, they shouldn't, other than spills at the surface, they really shouldn't affect underground water. But unfortunately, they do. The cement casings leak. The surface water accidents can affect groundwater as well. The leakage of the well, of course, contaminates the groundwater with methane itself, other volatile organic compounds, and of course any of the hazardous chemicals that are used in the fracking fluid. Groundwater and well water contamination have been noted in multiple states where fracking is occurring. Next slide. Go ahead and click through about 2 or 3 times. Hydraulic fracturing, of course, requires up to 5 million gallons of water per well per fracking. When this water comes back, it can't be used for drinking or agriculture because it brings back with it radioactive elements, high salt levels, other contaminants like arsenic, and of course the chemicals themselves. Go ahead and click again. And traditional water treatment facilities cannot treat this. So a lot of times this water is trucked away, it's injected into old wells or in places where it is assumed not to be able to be released into other groundwater. But as we know from a recent case in California, it affected irrigation wells in an area of the country that produces the vast majority of our vegetables and fruits. Next. Next, yeah, there we go. Next slide. There's a lot of air pollution that occurs as well. This can come from the leaking methane. It can come from the chemicals that come up, as well as the toxic chemicals that are put down into the well. Benzene, of course, is a known carcinogen and is often used in fracking fluid. Toluene as well affects the nervous system and can cause birth defects when exposed during pregnancy. Methane, ethane, and propane are actually, ethane and propane are come up from the well, and high levels of exposure cause neurologic abnormalities and even death. The picture here is small or ground level ozone, which of course is one of the worst and least controlled criterion air pollutants that causes respiratory difficulties, asthma and chronic respiratory exacerbations, actual decrease in lung function or lung growth. Next slide. Next slide. Yes, the A study done in 2011 showed that peak ozone levels in the winter in rural Wyoming were higher than in Los Angeles. Next slide. And so one, of course, would say, well, why isn't this controlled? We have the Clean Air Act. We have the Clean Water Act. We have the Safe Drinking Water Act. Go ahead and click 2 or 3 times. But all of these were exempted. So oil and gas production was exempted from these regulations by the Energy Policy Act of 2005. Go ahead and click again. And so states have been left on their own, some of which, like Pennsylvania, have really provided no regulation or guidance and, in fact, have protected this activity, whereas others have. Go ahead and next slide. So one of the things that one could say then is, well, if we had better regulation, perhaps the methane release or leakage would not be as bad, and that perhaps burning natural gas could be better than coal in the short term. Well, Barb will talk to you about upcoming EPA regulations. So there are multiple methods of trying to prevent the leakage. Obviously, the cement casings can be created more effectively. There can be a requirement to capture all the initial gas that is released when the drilling is occurring, as well as capturing any gas that comes up with the fracking fluid. This actually pays money, and but some of the producers are moving so quickly that they don't want to bother with that. They don't want to spend the money up front to make more money in the long run and capture this methane along with other saleable items. However, there really hasn't been a good answer to the difficulty in solving the long-term leaks from even conventional wells that is occurring. So while I think that we absolutely have to have regulation to protect public health and to limit the amount of methane that's released, it's not going to be effective enough. Currently, there's been a push for voluntary regulation, and there has been, in some calculations, about a 20% reduction in the methane leakage that had been occurring. But it's a long way to go. Next slide. So that brings me to the conclusion that energy efficiency and renewables are really the absolute best way, the least costly way, frankly, both for our health and also for our wallet, for producing electricity for our needs. Next slide. I wanted to direct people to the website. On the website, under the E&H tab, there is a variety of resources under hydraulic fracturing, on water, air pollution, as well as on the website, if you use the search function, you can find a report that was required through pushing by PSR Chesapeake chapter, as well as other Maryland organizations that required a full analysis of whether or not fracking could proceed safely in the state of Maryland. And the study is actually quite good. Not as rigorous, possibly, as some of us would have liked, but it has resulted as well, again, with pressure for a 2-year moratorium in the state to prevent fracking in the short term. So I'm happy to entertain questions.
Thank you, Catherine, for your presentation. At this point, I have here a question, but before I go to it, I need to remind folks that if you have questions, you should go to the little box on the right screen where it says question and type anything there, and I'll be able to read it out for Catherine to respond to. The first question I have is Jane Andrews was asking if natural gas is the same as methane.
That's an excellent question. And methane, the molecule, 1 carbon and 4 hydrogens, is anywhere from 95 to 90% of natural gas. And that there are other compounds within it, some of which are actually taken out to be used in other ways, like propane or ethane for other industrial processes. But the vast majority of it is methane. And natural gas sounds too good. So I like to use the word methane gas because that sounds maybe more harmful.
Okay. The next question is from Michigan, from Ronald Cardos. He says that at the moment they're facing the potential for 2 major pipelines, ET Rover and Nexus. Is there anything being done from the national groups down to assist those who want to oppose the construction of new major natural gas pipelines?
Well, that's a really important question. The positives about new pipelines is that we'll have less leakage. The downside, however, is that it will undoubtedly spur additional mining to produce more. So in terms of national PSR or local groups, we definitely are looking at mechanisms and methods to reduce the move to increase the export of natural gas, which again will increase mining and additional, creation of bringing it to the surface and allowing it to work as a greenhouse gas. We haven't specifically worked on that in Michigan at this point in time, but appreciate you bringing it to our attention.
Another question, if the United States is such a great exporter of natural gas, why are we importing it?
Well, we're really not exporting it yet. The companies would really love to export it. We import it from Canada primarily, just like we import, Canada is our biggest, is the biggest exporter of oil to the United States as well. The oil companies and the natural gas companies would love to export it, and there's been a lot of licensing attempts to get liquefied natural gas facilities built off the coast of New Jersey and New York, off the West Coast, Oregon and Washington, where they're being strongly opposed. And part of it has to do with geographics. So in the Midwest, if there's more fracking going on in the Marcellus Shale, it's maybe easier to import gas from Canada than it would be from building a new pipeline from the new areas of hydraulic fracturing.
Okay, thank you. Robert Simpson from Flint, Michigan asks, how has the New York State banning fracking laws been holding up under challenges to their legality?
It's been holding up well. However, in New York, there is talk of building pipelines as well, creating natural gas storage facilities at Seneca Lake and other beautiful in the lake country there. And the thing about natural gas is that a lot of heating systems, of course, many people heat their homes with natural gas. So until we start addressing that issue, natural gas is certainly needed in many areas for heating in addition to the electricity production.
Okay, thank you, Catherine. I think at this point...
Do you want to take that other question?
The Cliff one, I thought maybe later we could, he says to email it to him.
Oh, okay. No worries.
Okay. no worries about that one. So at this point, thank you, Catherine. Thank you for your time and efforts and all this. I'd like to introduce Barb Gottlieb, the Director of Environment and Health at PSR, who will frame and explain this month's action. Barb?
Thank you, Paz. Thank you very much. First, I would, let me show you my screen. There you go. I'd like to thank everybody who's on the webinar today who has taken action up to now through our climate health action teams. We've had, as I mentioned earlier, this is our 4th webinar, so we've had a series of actions. And it's really great to know that a number of you are taking action and continue to take action. Because, you know, we're always delighted to have you on the webinar or to have you watch the webinar content afterwards once we post it on our website. It's really important that you're learning. But our ultimate purpose here is to use what we learn to assert pressure so that we get the healthy energy system that we need and reduce climate change. So your actions are really very important. So we've just heard, thanks to Dr. Thomasson, why natural gas is not the alternative to coal. And we really feel it's very important for you to know and understand this as we gear up to support the Clean Power Plan in our individual states. In many states, utilities and other stakeholders will be pushing to replace coal-fired power plants with plants that burn natural gas instead. And so as you've heard, that is not the path that's going to lead us to a clean, a health protective, or even ultimately a livable energy system and world. And it will also have the effect of squeezing out energy and energy efficiency and renewable energy, which are the options that we need to pursue for a healthy, livable future. So when the Clean Power Plan is finalized and made public this summer, we'll be able to take action in our states to push for clean energy. But in the meantime, there's a separate action that you can take to help steer our country away from the multiple hazards associated with natural gas. This summer, the EPA, the Environmental Protection Agency, is going to introduce a separate rule, separate that is to say, you know, apart from the Clean Power Plan, that would set limits on methane leakage from methane extraction sites. This means it will be addressing natural gas wells across the country, both those that use fracking for gas extraction and those that use conventional means. In all of those sites, it will propose limits on methane leakage from the wells themselves and from the well-related equipment. As you can see in this photo, and you saw it also in Dr. Thomasson's presentation, gas extraction is heavy industrial activity that utilizes lots of equipment, whether it's for drilling the wells or compressing the gas, transporting it via pipelines. And as Dr. Thomasson mentioned, there can be and there often is leakage at all of these points. So we're going to look at an action related to that rule. I just want to repeat myself. What I'm about to tell you about is not the Clean Power Plan. It's a separate rule that will be proposed by the EPA this summer. But we're addressing it today because it offers us another shot at limiting methane leaks, at protecting the climate, and placing limits on natural gas extraction that we think will be very helpful when the states begin to think about which way to go this summer and beyond with the Clean Power Plan. So then, for this month's action, I'd like you to send a letter to EPA Administrator Gina McCarthy, that's Gina in the photo, and asking that she make this upcoming methane rule as strong as possible. It's an upcoming rule in the sense that we haven't even seen the proposed rule yet, so we're in a very good time to be putting out this message that this rule really needs to be strong. We've put a draft letter to the EPA on PSR's website to make it easy for you to send. So that's the message that we're going to be sending in the letter. Again, I'll walk you through the letter in just a minute. But the points are very basic. The points are very easy to grasp. Methane is a threat to health. It threatens all of us through climate change. Of course, people living near gas extraction sites, especially fracking sites, suffer in many more ways, but all of us are affected by climate change. And what that means is that all of us need to take action. Now, this is the URL of the letter that's on the PSR website. We'll send it to you by email tomorrow. So if any of you are really keen on writing it down, you can do that. But if not, we will send it to you. What I'm going to do now, though, oops, sorry, I just went to the wrong place. There we go. So this is the PSR website where that you will get to if you press on that that bit.ly short version of the URL. And as you can see at the top of the page, it's the letter that I was referring to Administrator Gina McCarthy. And the text of the letter is a little bit lower down in this box that you can see. So I'm just going to walk you through it. At the very beginning of the letter, I am writing as a choose those that apply. Some of you are health professionals, some of you are not. Some of you are members of Physicians for Social Responsibility, some of you are not. In fact, I know that we have a number of folks on the call tonight from other organizations that are working on methane. Welcome, methane partners. So those of you who are not part of PSR can just erase this and go on with the rest of the text. The letter goes on to say that methane is a potent driver of climate change. This is what Dr. Thomasson was telling us about. It's a greenhouse gas that's increasing climate change at rates that, in a 20-year time frame, vastly outstrip the climate impacts of carbon dioxide from coal. The letter goes on to say that, and it cites the EPA website so that they know that we've been paying attention to what they say, but it also points out that the IPCC, the Intergovernmental Panel on Climate Change, gives us that figure that you heard earlier, that methane's global warming impact is 86 times greater than carbon dioxide over the 20-year time frame. In the next paragraph, one more little thing that you can change. We talk about how climate change threatens human health. And what I'm suggesting is you talk about how that's happening where you live. So in my own part of the country, climate change is already contributing to. And then again, you can just delete those things that aren't relevant to you. So if there aren't crippling droughts and impacts on food production in my region, I could just do that and then delete it. And then we move down to the things that we're asking the EPA to do. Again, these are simple, non-technical asks. The first thing that we want are enforceable standards, not voluntary standards, but things that really are going to be enforced and made real, to address existing sources, not just new and modified sources of methane and smog-forming pollutants in the oil and gas industry. So this question of existing sources is really critical. It's very important that the rule address wells that currently exist, not just wells that will be drilled in the future. Obviously, if the rules don't address the wells that currently exist, it leaves a big opportunity to reduce methane. The second point is that we're asking for standards for equipment that would substantially reduce emissions throughout the entire oil and natural gas supply chain. The supply chain is just exactly what Dr. Thomasson walked us through. It's the wells themselves, the process of digging them and the process of using them. It's the purification of gas, the compression and transport of gas, and the delivery and burning of gas. So these rules have to address the whole process, and that's what we mean by the supply chain. And then finally, we ask that the rules lay the groundwork for strong methane standards for existing equipment. And the rule is expected, again, it hasn't been produced yet. We haven't seen the proposed rule, but it's expected that it will address new and modified equipment. Just as with the wells, we want EPA to look at methane leakage from existing equipment as well. So that's the letter. We also ask you to sign the letter over here to the right where my cursor is with your name, first name, last name, and then suffix is if you're a health professional, let us know that by clicking on the appropriate credentials. We ask you to put in your city and state because that really adds greater weight and legitimacy to your letter. You don't have to tell us your zip code if you don't want. And then you press send, submit. It's just that simple. So that's the action. And by taking this action, you'll be conveying a really important message to the EPA that all of us are harmed by methane from natural gas because it's a climate change driver. We don't even address many of the harms that Dr. Thomasson referred to, the other VOCs and toxic chemicals that are used in fracking, or the fact that methane is a precursor gas that contributes to ground level ozone and is thus damaging our lungs. This rule, in other words, is just one step. And to be really honest with you, we don't know how strong this rule is going to be. We've heard that it might not be even close to as strong as we would like it to be. But pressure at this point matters because it can help shape the rule that EPA proposes. And then more broadly than that, it's just important to keep the EPA moving ahead on this issue, starting to get methane leakage under control, while we as PSR and ally organizations, as the climate health action teams, we move ahead through the Clean Power Plan to put renewable energy and energy efficiency in place. So I thank you in advance for taking this action, and we'll report back next month on our next webinar on how you have done through your climate health action teams. So back to you, Paz.
Thanks, Barb. At this time, while I wait for my desktop to be, the screen be brought back up for my last slide, Catherine, I think we have time for one other question. This is, have there been studies that have documented the rise in levels of volatile organic compounds contamination of drinking water supply? And if yes, what extent is the increase in incidence of toxic reactions among people living in areas of fracking?
Well, that's a huge area. Can you hear me?
Yes.
Great. That's a huge area, and you know, if it's caught and people are testing their wells in particular, they may choose to, you know, use bottled water, or if they notify the companies about it, then they sometimes sign a piece of paper saying that they're not going to release that information, but are supplied with alternatives by the company. So the part of the problem is that wells are not tested regularly, and so we don't know that people are having problems. I think it was either Wyoming or Colorado that is working on passing a law saying that all wells within a half a mile of a fracking site will be tested at the expense of the company. Well, if you actually look at the dimensions of these well fields, a half a mile is too narrow. That it's actually wider than that where the wells can get contaminated. So more testing is absolutely essential. The presentations that have been done by PSR and in consultation with the Southwest Pennsylvania Environmental Health Project in Pennsylvania recommends people who live in these areas to test their wells for something very simple like salts, which will then let them know that the only way to get that in their well is from fracking fluid. So it needs a lot more monitoring and registry of illness that is not obstructed in these areas that, you know, of fracking, which is now occurring in about 33 states.
Right. Thank you, Catherine. At this point, I'd like to extend my thanks to all who have joined us tonight. I have up on the screen the information for next month's webinar. It'll be next Wednesday, May 20th, 2015, 8 to 9 p.m. Eastern. The topic is wind power, clean, efficient, and healthy. I also have up there my contact information because we want you to do two things. Remember to follow up with tonight's action and let us know. Either if you do it through our website, then we will immediately know. But if you do it individually or outside the website, please let us know. And also, if there's any questions or comments that you have about this issue, the chats in general, the Clean Power Plan, contact me. I'd be glad to respond. Please remember also that the webinar is recorded and will be posted on our website. I look forward to future conversations with you and collaborations. In the coming month, you should look for more information about state-specific resources and groups working on your state's Clean Power Plan implementation plans. We will be moving from the training phase and chats into the next phase, which will begin the collaboration and engagement with other activists in your state. The voice of the health community on climate change is extremely important and influential. Your voice is incredibly vital in these efforts. Thank you for being part of this important endeavor. Thank you, everyone, and good night. See you next month.